Value-based procurement is pretty intuitively simple. It's how do you give patients the best care you can within the most cost-effective way. For us as a procurement organization, I think we recognize the inherent complexities around that, and we think we can help to achieve that goal. Value in the context of value-based procurement is really a little bit in the eye of the beholder. Patients see value in getting care where they want it, how they want it, when they want it. You've got government who is fiscally constrained and needs to be able to manage the taxpayer dollars. You've got healthcare providers who have to figure out a way to deliver the care, and you've got suppliers who are trying to sell new products and services. As part of the ICD initiative, Plexxus saw a leadership role in the beginning is really just getting stakeholders to the table to talk. We believed we could leverage some of the procurement expertise we have to help actually lead and facilitate that process.
We were looking for opportunities to try and do some kind of innovative procurement, and this one seemed to present itself as a great opportunity. We've done a number of initiatives for the cardiac portfolio already. We've taken it to market so many times. The process has driven price down to a point that we weren't sure there was going to be something else. So we really had to think about what could we do differently. We have historical experience working with other SSOs. We've done other initiatives together. So we asked a lot of questions of the hospitals. What were they looking for in product? Service and support was something that came up quite often, as well as remote patient monitoring.
The right conditions for a value-based procurement are quite complex and will certainly depend on the situation. If you have the right contract alignment, you have probably a manageable number of hospitals. It's really hard to take out 150 hospitals to market together and create a governance structure around that, but 12 hospitals was sort of like the sweet spot to try something different, and obviously having that patient demand and ability to do something different on behalf of patients. So one of the other factors that we considered as part of the value-based procurement for ICDs and CRTs was the fact that we were really in this interesting space of volumes going up and costs going down. This allowed us to look at the category in a very, very different way and realize that there was probably an opportunity to take savings or other value that we could create along the patient pathway and actually reinvest value back into the patient pathway.